Hey, my name is Tina Jenkins. I'm a physical therapist and an occupational therapist. I work at the Vereen Center here in Moultrie, Georgia as an inpatient acute care therapist here at Colquitt Regional Medical Center. I have been here since 2015 and it has been a pleasure to work in Moultrie at Colquitt Regional Medical Center. I'm originally from South Carolina. I did my undergraduate work at Clemson University in Clemson, South Carolina, go Tigers, and I got my physical therapy degree at the Medical University of South Carolina in Charleston, South Carolina. That was way back in 1982. In 2004, I went back and got my occupational therapy degree at Belmont University in Nashville, Tennessee, because my career has been working in rural Southwest Georgia. I worked at a very small hospital for quite a while. We did not have an occupational therapist, and I took that opportunity to go back and get a dual degree at that time. Well, way back when I was in high school, my father was a dentist and my mother was a nurse. I knew I wanted to somehow be in the medical field. Didn't want to be a nurse, didn't want to be a dentist, and probably wasn't smart enough to be a doctor. And I just loved movement. I was a high school cheerleader, majorette back in the day when they had majorettes, and I just loved something about moving. And I knew the wellness and benefits of it even in high school. So I wanted to work in a hospital medical center, but movement was my thing. On a day-to-day basis, I'm inspired by my patients, really. I come in and I'll have a patient who maybe just had a total knee replacement. You know, they've been living with pain and disability for possibly a year, 6 months, have had trouble getting around, have had the detrimental effects of that, maybe weight gain, they have blood pressure issues, diabetes, things like that. And you know, they found the courage to do something about it. You know, I'll get depressed when I have a headache. So they inspire me, and it inspires me to come in, and if I can help in some small way to get them back up on their feet and get going, the day's been well spent. I really do love being a physical therapist and occupational therapist. And again, what I think I love the most is really being having a relationship with the patients, helping just a little bit on a day-to-day basis. You know, I'm older now. I'm probably 8 to 10 years from retirement. And the older I get, the more I realize that each day is valuable in itself. You know, maybe I can't get them running a marathon today, but if we can make their day better by getting them out of that bed and sitting in the chair, that's a win-win. And that makes me feel good and enjoy my day. Also, as a physical therapist and occupational therapist, we get a chance to chat with patients and have conversations, and I try my best not just to talk about the negative, oh my goodness, you've had a stroke or you've had a total knee and you're gonna hurt and what are we gonna do? I try to talk about, well, next month, maybe you can go fishing. Next month, you know, I know you have a trip with your grandkids planned. You know, I try to be positive and help them look ahead to the future and just enjoy the moment.